Imagine you're an airline pilot. It's minutes before takeoff, and you're finalizing the steps needed to ensure a safe departure. In front of you is a checklist. It is simple, brief, and to the point. Short enough to fit on a memo pad, with step-by-step checks for takeoff, flight, landing, and taxiing. For more than 70 years, the Pilot Checklist has been helping pilots control the safety of both their planes and passengers. In 2009, when U.S. Airways Flight 1549 had to make an emergency landing in the Hudson River, Captain Chelsea Sully Sullenberger and his crew followed step-by-step procedures with the help of a pilot checklist to save the lives of 155 people. They recognized that it required teamwork and preparation, and that it required them long before the situation became too complex and dire. As veterinary professionals, a checklist of written protocols helps make sure your clinic's nutritional recommendations are met every day. Whether you are trying to make nutrition a priority in your clinic by making it the 5th vital assessment, or trying to address any other issue that is important, developing protocols that are specific to your clinic's needs is critical. First, become familiar with the AAHA Nutritional Assessment Guidelines for dogs and cats. After reviewing the guidelines, decide what steps are right for your clinic. When you decide the right steps to take, write them down in a checklist and make sure each member of your team is involved in the process and that he or she is aware of their roles and responsibilities. This will reinforce the team approach mentality and enhance consistent communication to your clients. We spoke to your peers who already make nutrition the 5th vital assessment in their clinics and have created a list of tips and other helpful advice for you and your team to use to help develop your own written protocol that best meets the needs of your patients in practice. For example, at Town & Country Veterinary Animal Hospital in Stark, Florida, the staff always asks the pet owner if he or she has any questions regarding the veterinarian's recommendation and make sure to send them home with an information packet about the food. At the Highland Animal Clinic in Boston, Massachusetts, the veterinary technician records patient history using a nutrition history form to help ask questions and initiate discussion. Additionally, once the veterinarian makes a specific nutrition recommendation, they also document the recommendation in the patient's records to help aid in compliance. At Smith Veterinary Hospital in Thornhill, Ontario, the front desk staff dispenses the food and reinforces the recommendation. In addition, they schedule a callback in 2 to 7 days if the recommendation is for a new food. Whether you're an airline pilot or a veterinarian, using a formal protocol doesn't have to be complex, but documentation and evaluation are still very important to ensure accountability and compliance of the entire staff. By establishing a formal protocol and process that best meets the needs of your hospital, you're not only helping provide your patients with optimal care, but also reinforcing the importance of your recommendation. For more information and examples of nutrition protocols to download and use at your hospital, visit everypeteverytime.com today.